नमस्ते बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Neuritic Science in JV'n University. Today we are going to discuss about Alzheimer's disease. This is the series of psychiatric disorders and various neuronal diseases that are commonly encountered in day-to-day practice. In the last lecture, we have discussed about dementia, and in that we have discussed that dementia was caused due to Alzheimer's disease. One of the important causes of dementia was Alzheimer's disease. So today we are going to discuss about Alzheimer's disease. Again, a very small topic, but an important topic because we see the day-to-day patient and day-to-day course of the Alzheimer's disease. So let's start with Alzheimer's disease now. Now, Alzheimer's is the most common cause of dementia. So, of course, dementia was a disease in which there was a degeneration of the cortex. That was happening mostly at the age of 65 years in old ages. And in that, the functioning of the patient was gradually decreased. The normal functions like calculations, like orientation, and his functions, which was very easily lost slowly. So, in Alzheimer's disease can manifest as young as the third decade. So, as we have seen, the dementia was commonly seen in the old age, but Alzheimer's can also affect the young people, like people, especially in the third decade. But it is more common cause of dementia in the elderly. So, Alzheimer's can even affect the old age people, the young age people, third decade, but it's more common in the elderly. There are various genetic factors which play an important role in the development of Alzheimer's disease. 15% of the cases are familial. The Alzheimer's disease families. Okay, these fall in two main groups. There are two main groups of Alzheimer's disease. One is early onset disease, in which the patient of the early age gets affected, and it is an autosomal dominant disease, inherited disease. And the other one is the second one is the later onset group, whose inheritance is polygenic. So number one is early onset disease with autosomal dominant inheritance, and the later one is the later onset group whose inheritance is polygenic. Polygenic means multiple factors are responsible for the development of Alzheimer's disease. Now, pathophysiology. What is the pathophysiology that is involved in this thing? Macroscopically, the brain is atrophied. So, the macroscopic features includes atrophy of the brain, particularly the cerebral cortex and the hippocampus. So, what is happening here is there is atrophy of the particular cerebral cortex and hippocampus. That you can see macroscopically with the naked eyes, but microscopically there are many changes, like there are neuritic plaques which are composed in the part of alpha beta amyloid, which are derived from amyloid precursor protein that is called as APP. So what are there? There are neuritic plaques that are composed in parts of alpha beta amyloid, and these are derived from the amyloid precursor protein APP. Neurofibrillary tangles composed of abnormally phosphorylated proteins, tau proteins are there, and the apolipoprotein E, or called as apoE, with the E4 elements accelerates the age of onset. So this is the allele, or the allele present on the gene that accelerates the age of onset of Alzheimer's disease, and it is associated with sporadic and late onset familial causes. So these are certain causes that are responsible for the development of Alzheimer's disease and the changes that occurs in the brain in cases of Alzheimer's disease. Now, clinical features. What are the various clinical features that occurs in the Alzheimer's disease? So in Alzheimer's disease, patients most often present with insidious onset of episodic memory. So there is insidious slow onset of episodic memory, followed by slow progressive dementia that involves over years. So there is loss of memory. Episodic means the patient forgets a particular episode of life, particular episode of that memory, and there will be dementia. The dementia we have already discussed in detail, which evolves over the years. So it takes years for the development of Alzheimer's disease. The cognitive changes begins with the memory impairment. So there are various kind of memory impairments and progression to the language and visual spectral deficits. So there can be memory impairments and progression of the language and visuospatial deficits. In 20% of the patients present with non-memory complaints. So it is not always memory in Alzheimer's disease, but in 20%, around 20% of the patient presents with non-memory complaints like word findings, organizational and navigational. So there is difficulty in word finding, there is difficulty in organizational work, and navigational, like he forgets the path, and he forgets the commonly known path for in which he is moving his ears. There are different stages and presentation of the Alzheimer's disease. There are different stages according to classified Alzheimer's disease. In the early stages of typical amnestic Alzheimer's disease. So in the early stages, what happens is the memory loss may undergo unrecognized. The memory loss can be unrecognized. The patient cannot recognize that they are having memory losses or be ascribed to patient forgetfulness of aging. So he can become forgetful. He may not recognize that he's having some changes in the Alzheimer's disease. The cognitive problems begins to interfere with daily activities. So the cognitive problems start interfering with the daily activities. He may not be able to do the work properly, which he was doing previously, such as keeping track of the finances. He forgets पैसा कहाँ खर्च कर गया, भूल गया, बाजार गया था, इसको लेके आया, याद नहीं आ रहा. Following instructions on the job, he forgets what he used to follow, what was ordered by the boss to complete the task. He forgets to complete the task. The driving, he forgets how to drive. He purchases the shopping bags and forgets them. And housekeeping. So he forgets different kind of activities in the early stages. In the middle stages of the Alzheimer's disease, the patient is unable to work. So as the disease progresses, he is unable to work and is easily lost and confused. So the patient becomes lost and confused and requires a daily supervision. So he requires a daily supervision. Somebody should supervise him for completion. The language becomes impaired. His language becomes impaired. First naming and then comprehension and finally fluency. So first he forgets the name, then he forgets comprehension, and then finally the fluency is disturbed. As the disease progresses, apraxia emerges and it troubles performing learning sequential motor tasks. And slowly and steadily what happens is he forgets the sequential motor tasks, motor activities. जैसे अगर आपको स्क्रू कसना है तो किस तरह कसेगा, राइट में जाएगा, लेफ्ट में जाएगा, किसी भी चीज को फिट करना है कैसे फिट होती है, तो जाता है. The visuospatial deficits begin to interfere with pressing. Because of the visuospatial deficits, वो बटन सही से नहीं लगा पाएगा, वो ऊपर नीचे बटन लगा देगा, ईटिंग सही से खा नहीं पाएगा, मुंह में खाना डालना नाक में डाल देगा, और इवन वॉकिंग चलने में दिक्कत आएगी, उसको सही से चल नहीं पाएगा. And the patient failed to solve simple puzzles. And जैसे जैसे memory loss होती है, simple puzzles भी नहीं solve कर पाता है. 1 + 1 2 होता है, ये भी नहीं पता. And copy geometric figures, again, copy geometric figures. Simple calculations becomes difficult. You keep on thinking about simple calculation. What is 2 + 2? What is 3 + 3? What is 22? These simple calculations also become very difficult for him. In the later stages, some person remain ambulant. कुछ लोग तो चलते फिरते रहते हैं later stages में बहुत aimlessly. Like बाहर निकल जाएगा, कुछ लेने के लिए भूल जाएगा क्या लेने गया था, घूमता रहेगा, घर का रास्ता भूल जाएगा. And he keep on wandering aimlessly, and there is loss of judgment in reasoning. So he cannot judge or he cannot reason. The delusions are very common. And in the end stage, as the disease progresses, in the end stage, the Alzheimer's disease becomes rigid. Rigid and mute, forgets what to speak, and therefore he becomes mute and absolutely there are no words that he can speak of. And so he is bedridden, and help is needed with eating resonate oil. So there are various help that is required for performing various kind of activities. Investigations. What are the different investigations that are needed in cases of Alzheimer's disease? We have to perform brain imaging that reveals the atrophy begins in the medial temporal lobes before spreading to lateral and medial parietal temporal lobes. So brain imaging is required, which can assess the atrophy in which portion of brain that begins in the medial and temporal lobes before spreading into the lateral, medial, parietal, temporal lobes. and lateral frontal complex. The rest imaging are same as mentioned in the dementia. Now, what is the treatment? The treatment, Alzheimer's disease cannot be cured. There is no highly efficacious effective drug that exists as for now. The use of cholinesterase inhibitor drugs and symptomatic management of the behavioral problems and building support with the patient and family members is important. The drugs like donepezil and rivastigmine and calentamine and are very important drugs which are usually given in cases of Alzheimer's disease. The depression can be cured with antidepressant, and the control of agitation can be done by antipsychotic medications. The notebook and daily post reminders are very useful. You can write on a piece of paper so that you cannot forget these things. This was all for Alzheimer's disease. In the next lecture, we will be discussing about Parkinson's disease, probably the last topic of neuropsychiatric disorders. The session was powered by digital version 2.0 JAYOTI VIDYAPEETH Alzheimer. I hope you are satisfied with the my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. We will meet in the next session tomorrow.